I'm Dr. Douglas Richter. I'm a cardiologist in southern New Jersey. I was diagnosed with Marfan syndrome when I was 12 years old. I was going for an annual ophthalmology appointment to get a new prescription for glasses for school. And when the ophthalmologist dilated my pupils and looked in my eyes, he saw that my lenses were off center. Upon hearing that news, I was, pretty devastated, and I was kind of in disbelief because I didn't feel all that abnormal. In 1975, that was not a good diagnosis to get. The prognosis was quite poor. The average life expectancy in 1975 for a Marfan patient was about 45, 46 years old. Actually, at the time, I wasn't even the tallest kid in my class. You can have a multitude of issues, from scoliosis to joint dislocation, long arms and legs out of proportion to the torso, long fingers, some hypermobility problems in some people, and also the eyes. You get destruction or breakdown of the little fibers that hold the lens of the eye in the center of your eye in line with your pupil. Long story short, I ended up needing a surgery to correct that problem. And then I went home after the hospital, and then the other lung collapsed, and I had to go through the same process all over again and get a second surgery. Every day I wear contact lenses now, and these are just basically graduated bifocals, progressive lenses, so that I can accommodate for distance. As time went on, I'd had problems with hernias that needed surgical correction, again because of the fibrillin not being a strong enough connective tissue. You're more prone to hernias. And as a cardiologist, I knew that it was time to replace or repair, I should say, my mitral valve. And if I was going to have open heart surgery to fix the mitral valve, even though my aorta was not at the size where we would normally send a Marfan patient to surgery, since they were going in and I knew that that was eventually going to be needed, after a discussion with my surgeon, we decided to fix the aorta as well. Fortunately, she's having a much better course than I had, because there are medicines now that are used to treat the condition that weren't available when I was younger. Now, Marfan patients are living into their 80s and have pretty much a normal life expectancy. Although he was right for what was happening at the time, didn't take into account the developments that can happen. I am not disabled. I have driven many cars, and I drive a car every day. I've been quite successful in holding down a career. I hardly ever miss a day of work for anything Marfan related. So the future is bright for Marfan syndrome, and with the science of genetics advancing every day, someday there may actually be a cure.